Hello, my name is Andy Higgins, and this is a report from Salford Deaf Community Gathering, a Salford-based community group. Deaf People in Salford 2023. All our journeys start with listening. Dame Evelyn Glennie, a deaf percussionist. Salford has had a deaf community-based organisation since the Salford and Manchester Deaf and Dumb Benevolent Society, which was established in 1849 by James Herriot. This centre closed in the 1970s, which was based on Gardner Street, Salford M6. From the late 1970s to 2003, the deaf community revolved around a central hub from the Manchester Deaf Centre. Monies from the old Gardner Street organisation and sale of its building was pooled to develop a more central location to support predominantly British Sign Language users in Manchester and the suburbs. During the COVID-19 pandemic, many deaf, hard of hearing aid users, and those who have any type of deafness were disproportionately affected by the lack of deaf awareness, and that resulted in deaf people having unequal access to information and accessible communications. The government and local authorities providing critical information to deaf, disabled, and those with access needs in national, regional, and local services failed to ensure their communications were accessible. On the 23rd of March 2020, the Right Honourable Boris Johnson, Prime Minister, made an address to the nation via the BBC. This broadcast was only subtitled and by the BBC, meaning 120,000 people who use British Sign Language as their first language were denied access. It meant at a time of inaccuracy, misunderstanding, conspiracy theory, the needs of deaf people to have clear information were failed by the Cabinet Office's lack of deaf awareness and reasonable adjustment, assuming it wasn't their responsibility. In 2021, the #WhereIsTheInterpreter campaign successfully challenged the UK Cabinet Office in Cabinet versus Rowley via a judicial review. This led on to the child of deaf adults and former MP for West Lancashire, Rosie Cooper, presenting the British Sign Language Bill that later received royal assent. The final bill that received royal assent by the late Queen Elizabeth II in 2022. This Act calls on all government departments to issue guidance on how to communicate effectively with deaf British Sign Language users, BSL users. In Salford, most deaf BSL users didn't know what was happening. Services closed. Community services and groups stopped and people became isolated. Our city wasn't equipped to ensure deaf people were adequately catered for, to ensure they had access to information, advice, and guidance to support services. Ad hoc volunteers tried their hardest to ensure the deaf community were connected, informed, and safe. As we pass the 2023 midpoint, there is much in Salford we can celebrate and be proud to share as many services which move towards being more accessible to those who live and work in the city. However, all is not equal and there is still much to be done, and services change to ensure true accessibility for deaf people in our city. The scope of this report is attempting to be a holistic overview of deaf people in Salford, the current needs, wants, and recommendations of deaf people are simply to have the same access as their hearing peers, that they are able to access them independently without reliance on others. Using the Greater Manchester Coalition model of independent living has been chosen to establish what has been happening in Salford and what is recommended or is required moving forward. As stated above, there is much to celebrate in Salford compared to other parts of the United Kingdom and even other parts of Greater Manchester. That said, the statutory duty imposed on our public services and the necessary recommendations in this report highlight years of inaction or a process of consultation after consultation where action is minimal or stalls for many reasons. The publication of this report is to serve as a community response to recommend and highlight what needs to change, the balance of surviving in Salford to thriving in Salford. This report is primarily focused on deaf adults over the age of 18. There is a deliberate use of the word deaf with a small d, deaf with a capital D, and D/deaf. Quote, the BSL bill will help remove barriers faced by the deaf community in daily life and is a further welcome step towards a more inclusive and accessible society. Chloe Smith, MP and Minister for Disabled People, Health and Work. The contents page, history, contents, overview and scope, accessible information, adequate income, accessible healthcare, accessible social care, accessible transport, accessible environment, technical aids and equipment, accessible housing, adequate provision of personal assistance, equal employment opportunities, independent advocacy and self-advocacy, peer counselling, Salford's Deaf Community Gathering, conclusion, key recommendations, glossary, references with additional resources, contact details. Quote, some people want to sign, some people don't. Some people want to do both, but give us the chance. Rose Ayling-Ellis, deaf actress and campaigner. A brief overview of the principles of independent living for disabled. Right from the outset, many deaf people don't associate with the label as being disabled. Although this label is what defines a protected characteristic label under the Equality Act 2010, other Acts of Parliament in the UK, Europe, and for the United Nations Convention on Rights of Persons with Disabilities, the UNCRPD. Terminology of deaf defines those deaf people with a small d who use hearing aids, behind the ear, cochlear implants and bone anchored, and active listening generally to communicate. This group of people mostly live within the hearing world using speech and language skills. Deaf people with a capital D are predominantly British Sign Language users. They don't rely on hearing and speech, but use as a deaf person is likely to be one whose first language is British Sign Language, and for whom English will be a second language. They will primarily communicate via sign language and will usually require the support of a sign language interpreter. They will also lip read in part of their means of communication, but this should not be relied upon. A deaf, with a small d, or hearing impaired, hard of hearing person will likely to have hearing aids and will use those as well as lip reading to communicate. Deaf people with a small d make the majority of people with deafness. People who use hearing aids may also use induction loops, Bluetooth, or other innovative technology to access sound, for example in public spaces and meetings. Induction loops are useful, but not infallible. There are means of communication and a number of factors impact on their use. There are varying independent living models around the UK, We have chosen the one modified by the Greater Manchester Coalition of Disabled People as part of the Nothing About Us Without Us campaign. And there's a YouTube reference. It's part of the 7 Needs of Independent Living. See also a Social Barriers Model of Disability, Theory and Practice, The Emergence of the 7 Needs by Ken Davis, published in February 1990. The model has since been expanded to 12 themes, referred to as the Pillars of Independent Living or the 12 Basic Rights of Disabled People. The model we've used is an expanded model of that originally created by the Centre for Independent Living in Berkeley, USA, in the early 1970s. Generally, across the Northwest, there are paternalistic views of disabled people. Many deaf people only want to be able to live independently, whilst having their access needs met. This could be a language professional like a BSL interpreter or lip speaker, or a loop system and access to Bluetooth technology to allow them to hear clear sound when accessing public services. Independent living needs for disabled people was born out of the shared experience and shared living needs. True independent living is when, quote, a person has control over their life and are able to make choices. In the 1980s, deaf people largely relied on public and voluntary services from the Social Services of Salford Diocesan Catholic Deaf Church in Manchester. The only other feasible option was to rely on family or friends when they were available. Access was only a focus in the UK with the introduction of the 1970 Chronically Sick and Disabled Persons Act, championed and led by the late Manchester MP, Lord Alf Morris. Since then, the 1990 NHS and Community Care Act, the 1995 Disability Discrimination Act, the 2010 Equality Act, and 2014 Care Act, to name only a few. Despite legislation predominantly placing a duty to provide reasonable adjustment or reduce inequalities, there is still the difficulty in people being empowered and independently able to access services in Salford. The principles of independent living. Number 1. Accessible information. Quote, Salford is rich with resources to help, support and empower the community. But finding that resource is like searching through a 1,000-piece jigsaw, picking up the right piece at the first time. Information is primarily provided in English in all communications from the local authorities and VCSE sector, the voluntary, community and social enterprise sector. Social media platforms contains a wide array of media types and importantly doesn't meet the access needs of deaf people. Communications are usually accessible or a rare ad hoc basis when it is targeted at a specific demographic group of people. Despite the Equality Act 2010, the NHS Community Care Act 1990, the NHS Act 2006, the NHS Accessible Standard 2017, Salford Equality Strategy 2021, there is no consistent strategy to ensure information provided is accessible to deaf and deaf people. This is stated as deaf people who predominantly use English and need to access subtitles and clear sound audio, and also deaf people whose first language is British Sign Language and need services of a qualified, competent and experienced BSL interpreter or translator. In 2022, the BSL Act, HL Bill 136, was passed requiring all government departments to provide accessible information guidance. An example, in August 2023 this year, the NHS Greater Manchester released a range of BSL accessible videos. This was a huge step in accessibility for the whileyouwait.org.uk website. However, the website has been in existence for nearly 2 years, and this has meant The deaf community have had to be left behind for that period of time. Some recommendations: provide holistic guidance to all departments, like the BSL Act will do for government departments, either individually or as a council and health and VCSE sector collective, like the Salford Equality Strategy, on how to provide communication that's inclusive to the wider deaf people, and ensuring compliance to legislation, but essentially ensuring that the communications are out there and crucially understood by our Salford deaf community. Any audio or video media on websites or social media platforms should have subtitles and British Sign Language interpreted. See the Cabinet versus Rowley Judicial Review. All complex language information should have a BSL translation. In brackets, BSL and English are not the same. A review of all induction loops within the council to ensure they are fit for purpose and maintained under the BS 8300-1 2018 standard, and that staff are competent in their use. Theme number 2, adequate income. Here in Salford, many of the service users accessing our services are not in employment, have permitted work rights, or are of retired age, so we don't have any data or case studies. We would refer you to the Employment and Select Committee inquiry on the disability employment gap that's hosted by the Royal Association for the Deaf, and in the report the link is there. Deaf people in recent months have contacted us though for support due to the rise in inflation and the cost of living. We've supported people to change energy tariffs, reduce TV packages, or receive discounts and change of telephone and broadband providers. This is something they cannot get through council services directly, like the Better Off service, as they would have to wait for interpreters or lip speakers to be booked. Quote, one person was paying £56 a month for broadband, and we were able to reduce this to £25 a month for a significantly higher speed and saving them £372 per year. We have worked with 4 people to reduce chemist delivery costs from £3.50 per week to free, saving them £182 annually. That's over £728 collectively in total. Theme number 3A, accessible healthcare. Primary care. Currently, the Salford Integrated Care Partnership, Salford ICP, part of NHS Greater Manchester, has to provide British Sign Language, lip speakers, deaf-blind hands-on interpreters for all primary care appointments. However, this is not widely known by deaf people and providers across the city. We have data that optical services across the city are unaware when doing optical appointments that fall within the NHS service and can have a language service professional attending. In March 2022, the Salford Clinical Commissioning Group, now the ICP, set up a contract with Sign Live, a video relay service allowing deaf BSL users to contact their GP surgery for arranging appointments, organising repeat prescriptions and basic communication needs. In late 2022, the ICP set up the addition of video relay services for some appointments to increase capacity where there had been a difficulty in booking face-to-face BSL interpreters. However, we have raised caution that video relay services must not be used as a norm. This service is 3 times more costly and means that there is a loss in the ability to use BSL due to the small frame. Additionally, there's been no survey of practices across the city to ensure there is adequate Wi-Fi or Ethernet connections in consultation rooms, and also that premises internet connections are stable enough to facilitate the service. Losing connection delays appointments, loses continuity of interpreter, and also provides additional unnecessary stress and anxiety for both the patient and healthcare professional. Furthermore, older BSL users have said at the last resort VRS services should be used, but they don't want this used and as general practice prefer face-to-face interpreting, largely cutting out the chance of failed appointments due to technology. Further, in 2022, between October and December, Salford ICP report that nearly 40% of appointments that were requested went without a BSL interpreter present. Some constructive meetings have been had between the Salford Deaf Gathering and the Senior Improvement Team's manager. We hope these will be forthcoming in the future. Salford sexual health services remain inaccessible to deaf people. After a positive meeting in early April 2023, there's been no change or service improvement to ensure deaf people can independently book and via the website and use associated processes that should be easy to follow. Currently, many deaf people go out of the city to access sexual health services and get support from the Manchester Foundation Trust services. An update in late July 2023 came from the service to say the online booking system, Lily, has had more delays, and a release date or the opportunity to comment to ensure its accessibility hasn't happened. Too often, information is provided and then passed on, but rarely is there any accountability to ensure a response comes back. This is not a reflection on the engagement staff doing the work, but is a reflection on the process of transparency to take feedback and ensure an accessible response is received and debated further. Managers and commissioners need to directly engage with the deaf community to ensure they are commissioning services that are wanted and approved for the people using them. This should not be done in isolation, where commissioners can be accused of being ordist and discriminating against deaf people by contracting services that are not fit for purpose. All too often, services once contracted cannot be easily amended. See the graphic. Recommendations: provide a review into the existing Sign Live VRS provision with a view to rolling it out to cover all primary care and community health services, giving deaf people independence and empowering them to connect with services in the same way as their hearing peers, e.g. optical, pharmacy, dental, contact services, etc. Ensure the existing Sign Live contract covering all GPs and ICP services are on the Sign Live directory and listed correctly. Ensuring the new roles being given to pharmacists include resources for consultation with and treating deaf people. Ensuring quality deaf awareness and separate British Sign Language training is provided throughout the primary care and community health systems, ensuring that there is targeted engagement and priority bias to services that work with deaf people regularly. Ensure engagement staff and those working with the deaf people for lived experience studies apply and adhere to trauma-informed practices. Establish better channels for deaf people to report issues, both complaints, compliments and comments, so that there is a strategic plan across all services and that identified issues and actions and good practice can be shared citywide. Ensure where groups of deaf people interact with Salford ICP as a focus group or individually they are fed back to. All too often they are told it's been passed on, and there is rarely feedback response to deaf people giving a bi-directional engagement. Referrals from and to primary care to consistently have access information clearly identified. Public health to ensure messages, campaigns and important information in the community meet accessibility guidance, and that at the planning stage the specialist services are involved from the outset, ensuring information goes out at the same time as other formats. Information, no matter how urgent, should always be accessible and released at the same time as non-accessible information. Sexual health services desperately need intervention from the local authority commissioners to establish a timeline and ensure that this year's contract and any preceding contracts are accessible and that access can be booked during the booking process. Should there be issues with accessibility or language support, the service can then text the patient bi-directionally and also report all operational issues to commissioners. This should be in the tender contract specification and commissioning documentation. Create a working group of professionals and deaf people to look at the VRS services so these can be clearly understood and disseminated across the healthcare and deaf community, that people feel confident in using these services. Workshops on using VRS services for deaf people and similar for professionals would be useful. Secondary care. There have been identified many issues from the private healthcare sector and public healthcare sector from deaf BSL users in hospital without interpretation services to interpreters being requested and not confirmed, and a general lack of communication to patients. Too often the responsibility for access is put on the deaf person and not from a healthcare point of view. Many deaf people worry about their communication needs first and their health needs secondary when accessing hospital services. There is a distinct lack of two-way engagement from the Northern Care Alliance, the NCA, and from a community point of view, very little is being co-produced using specialist services, skills and experience. Northern Care Alliance's head of patient and service user experience has stated the NCA will not engage with us, Salford's deaf community group, but will use Salford Health Watch's project, Silent Voices, as a way to seek feedback and move forwards. Despite a meeting with ourselves to outline issues, this again has been one way to outline issues with a clear lack of bi-directional engagement. Whilst we feel there is a willing to change, it's a closed shop. To ensure what's being changed and happening to the deaf community and not with the deaf community. This goes against many Nothing About Us Without Us campaigns and the Salford Equality Strategy, to which the NCA is a stakeholder. As recent as the 7th of August, the NCA apologised 7 times to a deaf couple identifying multiple failures of several departments in the provision of language support and failure of the shared decision medical model. The complaint reference is 55404. There is a complaint that was lodged on the 13th of May 2022 and today has had no formal response. Complaint reference 43404. A follow-up email was sent about this on the 3rd of August, and on this complaint no response was received. A face-to-face meeting took place in May 2023 at Elm Bank Centre, hosted by Primary Care with a secondary care focus. This meeting wasn't properly resourced to meet the range of access needs, and some officers present failed to comprehend why this was important. Several specialist departments were not and are not being consulted as part of this undefined workstream plan of improvement. For example, the NCA's own audiology department were even unaware of it happening. A key stakeholder we feel should have been thoroughly integral to the process. Work is continuing in a silo, a closed shop, without the whole alliance and community approach and a conversation It keeps it exclusive and means contributions from specialists cannot be shared and discussed. This, with the addition of trauma-informed practice and working with key people, would truly create a co-production. In July 2023, the NCA stated to members of the Health Watch's Silent Voices group that they won't return to that group whilst they carry on with the work stream, and they will return in 6 months, which is early 2024. Quote, audiological services are based throughout the city's gateways and hospital, and the team of audiologists are working with the newest technology available to them. There is a wealth of experience within the team, with newer and long-standing experienced staff working together to achieve ambitious outcomes. A recent complaint from a deaf person highlighted issues with the use of induction loops for hearing aid users. This has, though, been thoroughly addressed by the team manager, and there is ongoing work to ensure deaf people who use induction loops can do so, and also look at the use of Bluetooth technology too. We, Salford Deaf Gathering and Audiology, have met and corresponded on a few occasions, and this has proved positive, sharing experiences, lived experience and good practice. An example of this was we've become a trained partner to help hearing aid users access batteries, retubing and parts. Discussions have been had to hold a joint clinic coffee morning to help people get moulds, retubing and advice and information. This can also help to introduce the induction loop and Bluetooth to hearing aid users, as appointment times don't really allow for this. It was discussed that an innovation funding bid could be a way forward to facilitate this. It was also highlighted we could encourage those people who no longer use hearing aids to re-engage with services by presenting at a D-Deaf Gathering event and sharing what has changed over the years and what is now possibly available. Importantly, this is not to bring in a medical model approach, but showing that older hearing aid users and newer ones could offer hearing support. It would also allow D-Deaf people to ask questions and share lived experience in a safe and supported space. Outpatients. The department generally varies in terms of being more or less accessible. It is understood there is a huge lack of awareness, and that although there are many issues, there are staff willing to learn and ensure patients are treated respectfully. The James Potter Building, the hospital soon to open and own the £68 million major trauma unit. This has been found to be inaccessible to D-Deaf people even before it opens. After a Freedom of Information request, the hospital responded that there will be 2 loop systems and a distinct neglect of access consultation employed. No mention was made to intercoms, fire alarms, or planned equipment that can be used portably. You can read the FOI on whatdotheyknow.com. The link is in the report. Positives to celebrate. Whilst many D-Deaf people feel the hospital services are poor in standard, there is a clear will to improve. We encourage this and plead with the NCA team responsible to widen the scope of its work out to specialists and D-Deaf people. There are many avenues the NCA can take to receive positive contributions and truly co-produce something outstanding and accessible that will be a legacy for all. Quote, in July 2023, the in-house interpretation team service reports terms and conditions for interpreters had been brought in line with national standards, and that the recruitment of casual BSL interpreters has increased. Quote, audiological services are looking at ways to improve their offering, and dynamic appointments where audiologists can remotely access hearing aids to make change is a bonus for users. In mid-August 2023, as this report is finalised, a deaf BSL user was admitted into Salford Royal. Despite asking staff on a patient call to us asking for help, we appealed to the healthcare staff visible in the call to book interpreting out of hours number provided to book an interpreter for the next day. They said to us they haven't called but emailed, leaving the patient the whole weekend without BSL interpretation support citing. Well, I wrote it on paper instead. The patient tells us they are in hospital because they have a weak body. Healthcare staff state the patient needs an MRI scan. The patient doesn't understand what this is because it's only been written on paper as, "You need an MRI," and has not explained the patient in first accessible language. 5 days as an inpatient, the patient still doesn't have a consistent approach to interpreter access and is reaching out to us for support, further proving we've become a key contact and vital link within the community. Private sector secondary care. A small D-deaf person recently had 2 poor experiences accessing the Oaklands Hospital, part of Ramsey Care completing work on behalf of the NHS. The deaf person reports that whilst waiting areas were the biggest challenge when names were being called by healthcare professionals wearing masks in a post-COVID period, the person had waited a long time, and when they approached someone who left the waiting room without collecting a patient, they were talked down to by their consultant, who said angrily, "I've called you twice." As a result, destroying the therapeutic relationship between them, meaning the person has disengaged from the service due to this. The person stated they were frightened to complain, and after the poor experience didn't feel on the second appointment the consultant was over the complaint. I didn't want to have further treatment from this professional due to their poor attitude. Oakland's reception manager did engage with us to highlight that they'd done some training with all staff to be mindful that patients may be D-deaf and bear this in mind. We had no further issues or remarks from deaf people since. Additionally, when arranging sign language professional support, there are cases of, "That's not us, you have to contact them. We're not responsible because it's outsourced care." Recommendations: D-deaf awareness training and clear guidance on booking language support professionals be available to all staff. This deaf awareness training should be consulted on with Salford specialists and deaf people. Engagement with the deaf community should have the appropriate language service professional booked, not necessarily the ones used for providing treatment services, and should that access not be available, the engagement stops until this has been rectified. A better way for D-deaf people to comment and complain in an accessible way. For example, using BSL with information on the website detailing this in BSL. The current plan workstream that's being used to be brought to the deaf community gathering and discussed so feedback can be provided. A full system-wide Salford review of services for D-deaf people ensuring language provision, interpretation and translation, support and technical equipment is fit for purpose, working and staff are trained in its use. A wider engagement with young people, e.g. with Salford's Deaf Children's Society to get the voice and opinion of primarily young people and secondarily their parents and carers. Engagement with healthcare specialists and professionals working with the D-deaf people across the city within healthcare to feed into the current workstream to ensure good practice is identified, replicated and shared, and poor practice is also identified and rectified. Trauma-informed practice should be employed in all scenarios of feedback, so D-deaf people shouldn't be made to repeat themselves, and that the first-time telling approach should be used. Review of the major trauma centre building accessibility prior to opening in October 2023, ensuring services are ready to meet the needs of D-deaf people under British Standard 83001 and 2 of the 2018 standard. Ensuring there is a consistent approach right across services, whether they be in-house or otherwise. There should be one point of contact for accessibility, not several, and the information available is not clear. For example, you contact X because it's NCA, but you contact Y because it's outsourced care due to a specific contract. There's an image of transforming psychological trauma from the NHS Forth Valley. Theme 3B, accessible social care. Current waiting times for occupational therapy are in excess of 6 months. This means that whilst there may be a different process for urgent priority cases, the general population are being left behind national averages. OT services in Salford have texted deaf people for information, who then forwarded these texts for us for translation and support to reply. And whilst this is useful, the access information from one OT to another OT doesn't happen. A recent case stated the person is hearing impaired, and the OT allocated was leaving voicemails and arriving without BSL interpreter access, without this information being passed on, leaving messages to say, "I've been to your house, please call me on this telephone number," which was a voice-only number. The triage occupational therapist had not clearly passed on that the service user required BSL interpreters and would not answer the phone. Without other accessible contact methods, the person had then only options available, which was to ask us for help, or St Joseph's Mission for Deaf People based in Collyhurst. There are no OT services in GP surgeries in Salford currently. However, there are reported good outcomes from this service being based within local surgeries. And there's an arcot.co.uk link. As GP surgeries undergo feasibilities to incorporate more services, training in accessibility is vital for their success, and they comply with the already stated legislation. For some in the community, there is a lack of trust within the sensory social work department, as reported to them at a July 2022 gathering. Deaf BSL users shared their experiences and stated they were unhappy with the current arrangements. They struggled to access the sensory social work team. We identified issues in the 2022 recruitment of a specialist sensory social worker. It means currently staff now are away from their roles whilst time is used to train and work without specialist training and knowledge before working with service users. The social worker advert in 2022 was recruiting a general social worker into a specialist sensory social worker role, and they embarking on the job training to upskill them. The team manager was challenged why a sensory job profile wasn't advertised, and the reply was, "We wouldn't get any applicants and we will train the people we have recruited." Access to equipment services are good, and the range of sensory equipment is contemporary and means the quality strengths-based assessments. There are suitable technological resources available. The wait time from our experience is short. Duty Friday mornings. Currently, only 3 duty appointments are available per week to deaf people. Most sessions are completed with a social worker and a BSL interpreter present. This has been happening since mid-2022, and the department's 2 BSL using staff left the service, one for a new post outside of Salford and the other on maternity leave. The Community Liaison Officer and Chairperson, currently the same person, has tried several times in offering to attend a sensory team meeting, but this was pushed back by the team manager at each opportunity to a summer date of 2023, which has not yet been arranged. Recommendations: deaf awareness training and clear guidance on booking language support professionals be available to all staff. The deaf awareness training should be consulted on with Salford specialists and deaf people. Guidance should state when remote or face-to-face interpreting is allowable. Referrals to and from primary care to consistently have access information clearly identified as per DCB 1605, the Accessible Information Standard of 2017. How to refer into the sensory service and others, and it should be presented in a video format with a BSL translator or local D-Deaf people and the sensory team so it's familiar. There should be a greater presence of sensory social workers within the D-Deaf community, and there should be close professional relationships between the sensory team, VCSE organisations and other specialists to share information, support each other and share good practice. A comprehensive service review should be commissioned from a specialist agency and make recommendations, like the Royal Association for the Deaf, Sign Health, or other organisation with specialist skills who are based outside of Greater Manchester. The Northern Care Alliance senior leadership team, including Salford City Council's place-based lead, to advocate for a specialist working party of specialists and D-Deaf people to work together with the above element and to ensure service reform that's accessible and fit for purpose in 2024 and beyond, possibly with the D-Deaf Partnership Board idea detailed below. Social care services have to access VRS services for taking referrals and for appointment arranging. NB, VRS services should not be used for conducting assessment appointments, including access to the sensory team for them to conduct assessments too, as per the Accessible Information Standard 2017 and the Commissioning Guidance for Primary Care 2018, publication reference 07518 documents. The NCA leadership to urgently review accessibility within the James Potter building to ensure it's accessible and meets the BS 83001 and 83002 2018 standards. A review of all induction loops within the estate to ensure they are maintained properly under the standard and that staff are competent in their use. Salford Deaf Community now to write to PHSO, Healthwatch Salford and the CQC on outstanding complaints that are beyond their 30 working days. Additionally, giving a summary of the issues being faced by D-Deaf people accessing the services 2021 to currently. The Salford Deaf Community to make representations to the Care Quality Commission on the issues D-Deaf people are facing at the NCA and ask that during any inspection this is an area they look at. For the NCA project staff working with the D-Deaf issues to engage meaningfully with us, that we can together with other specialist departments and stakeholders capitalise on their skills, experience and ensure D-Deaf people will face minimal barriers in the future, that they will be treated equally with their hearing peers and are empowered to make independent choices, that the NCA in the short, medium term establishes a consultation with D-Deaf people that has a senior leadership team leader or member present at a dedicated meeting either bi or tri-monthly to ensure senior leadership team are not receiving information from others but equally sharing their responsibility whilst D-Deaf people feel listened to and engaged with at the highest level. The NCA create guidance that for consultations and engagement with the D-Deaf people are accessibly involved. The recent care reforms exercise was largely inaccessible, focusing on English and not allowing for true consultation as there was little to no uptake from D-Deaf people directly. This should involve a mix of D-Deaf people and cover service provision through to sensory services. D-Deaf people through the inspection and communicate their wishes which haven't been accessibly or proactively taken into consideration during the pre-inspection exercise. See also technical aids and equipment. Number 4, accessible transport. TFGM and support engagement. Transport for Greater Manchester on a regular basis targets some D-Deaf and deafblind people for feedback on specific themes. However, D-Deaf people at meetings have expressed they cannot provide feedback to TFGM or individually bus, train and tram services easily. The system is complex and each company has its own way of allowing people to contact them. Normally, feedback is targeted to a specific agenda. Making complaints relies on English skills. Asking for timetable information or contacting TFGM also requires English, email, text, or the use of a voice telephone. Whenever there are changes at the last minute, for example on railway platforms, there is audible announcements which excludes deaf people mostly. With the current rail delivery group consultation of proposed ticket office closures, deaf people will be unable to access support during their journey. Deaf people struggle with intercoms and phones, and this will further push deaf people off public transport. It will also mean deaf people could be wandering around the station looking for staff that could potentially put them in danger. Quote, deaf people at a 2023 Salford engagement event with TFGM stated that if audiovisual services on board vehicles are defective, this should be likened to the wheels or brakes being defective, so that if the audiovisual systems on board are not working, the vehicle should be out of service. Driver service was the overriding issue. The lack of a deaf person may have more than one access need when using transport. Training desperately is required to provide deaf awareness to ensure the new B network is easy to understand and is accessible. Stamping of travel passes in the community was to be trialled, taking place in Stockport with Disability Stockport, but never happened where someone is deaf for life and needs proper assistance. This was working with Greater Manchester Disabled People's Panel. There's not a fair approach to this. Some deaf people have a concessionary and some have a concessionary plus. On many occasions it's luck of the draw. E-scooters, bicycles, pedal power assisted vehicles. Many deaf people have reported issues with these vehicles on pavements or areas reserved strictly for the use of pedestrians. Some deaf people have reported being hurt and had altercations with riders who are aggressive when encountering deaf people. It's clear that people using council-approved scooters, currently with Lime, are doing so in contravention of its own rules. Users of approved scooters not using pedestrian areas and must be in possession of a valid driving licence, for example. Recommendations. Deaf awareness training and clear guidance on booking language service professionals to be available to all staff. And this deaf awareness training has been consulted on with Salford specialists and deaf people. A comprehensive service review should be commissioned from a specialist agency to make recommendations, like the Royal Association for the Deaf, or organisation with specialist skills who are based outside of Greater Manchester. Driver training for the new B network to have deaf awareness included, ensuring deaf people have been consulted and have been able to agree the content. A deaf transport committee to be established and supported either in the Salford area or as a Greater Manchester partnership. This can ensure there are mechanisms for deaf people to feed into issues, provide a source of engagement, and make sure TFGM has consulted a range of deaf people who live and work within Greater Manchester. Transport for Greater Manchester should establish guidance on ensuring communications from the authority are accessible for deaf people and deaf-blind people. For example, images with alt text, videos with voice, clear subtitles and British Sign Language. The use of varying arrays of devices should be factored in when guidance is set, e.g. a mobile phone device, tablet or computer when accessing video media, especially with subtitles. There should be a Greater Manchester Combined Authority or Greater Manchester Standard adopted so everyone uses the same best practice. Interactive displays at interchanges and on vehicles are accessible with the use of QR codes that provide spoken, subtitled and BSL content. TFGM to establish clear ways that deaf people can contact the authority accessibly. The use of texting, like WhatsApp, and also through British Sign Language has been requested. This could be a central point for TFGM to then send out to a bus company if there is a complaint, comment or compliment, but also feed into engagement, marketing and information sharing too. Lime scooters to attend a D-Def gathering along with Salford City Council's Disability Officer and Greater Manchester Police to plan a way to target riders of these devices to educate, fine and reduce dangerous behaviour. A joint operation between TFGM, Salford City Council, Lime, Greater Manchester Police and Salford Deaf Community Gathering to check riders of approved scooters do so under the rules, e.g. riders are in possession of a valid driver licence as per the terms and conditions, and penalties imposed for pavement riders. Salford Deaf Community Gathering to work with Salford Disability Forum on their reporting scheme to ensure D-Deaf people can report e-scooter issues to them. This information can then be shared with multiple agencies. Number 5. Accessible environment. Public buildings access. A review in September 2023 is taking place of Salford City Council gateways. This is involving the Equality, Diversity and Inclusion Lead and also deaf and deaf-blind people along with the specialist worker. Contacting services. This is a bigger piece of work to inform the needs of D-Deaf people being able to accessibly and independently contact public services. The majority of people have to do this in person, but video relay interpreting services, text and email should always be available and ways to communicate. Only providing in-person, web form or voice telephone services exclude people from accessing help and support. Interpreting and translation provisions. D-Deaf people cannot directly book sign language interpreters or language service professionals. They have to first go via the service, interacting with staff who are not D-Deaf aware. Training then request access, taking many days or weeks before access then is provided. For the NCA, this is planned to change and communication cards will be sent out in the coming months, although we've not been briefed on the details of this. Interpret and translation contracting should have D-Deaf people involved in the process, as per the Salford Equality Strategy, also following clear historic and national campaigns of the Nothing About Us Without Us movements. D-Deaf Partnership Board. After discussions and comments from health and council engagement, there should be a short-term feasibility study into the creation of a Salford D-Deaf Partnership Board that can provide citywide information, guidance and be a go-to point of contact across the services of health and social care and the VCSE sectors. A one-stop shop type of approach to ensure services are consistent and information is given with a holistic view. A similar partnership board in neighbouring Trafford exists, and this should be studied and feedback from the tri-party of organisations should be sought in its creation. This should be done with Sign Health, the RNID or the Royal Association for the Deaf. It's important to note that access to libraries, recreational and wellbeing activities provided by many organisations and bodies in Salford, as well as the Salford Community Leisure, is not covered here and needs further reviewing. Additionally, D-Deaf people's spiritual and religious life has not been addressed here too. Number 6. Technical aids and equipment. There is good access to technical aids and equipment in Salford. People waiting from referral to assessment is short, and also the equipment is varied and provides a strengths-based assessment and the provision under this for need. Bluetooth, wired and wireless devices are featured in the equipment range. Coupling this with equipment from audiology and the private sector is helpful for those who can use it. Sometimes people need longer times to learn, refresh and become used to interacting with specialist equipment. Recently, a deaf person who paid to have their own cochlear implant fitted found great support from us when we taught her and gave her a custom step-by-step guide to connecting her implant to a mobile phone so that they can enjoy audio books and access phone calls. It was a huge milestone for this person, restoring what she used to do several years previous. It also was a humbling day for us too, to see this person's joy restored. Sensory services should have information provided and hosted on the council website in British Sign Language, plain English, and have a holistic directory of services across the city, possibly hosted by the CVS too. Equipment available should be demonstrated thoroughly, with follow-up visits as well as a maintenance plan put in place for vulnerable people to ensure equipment is not fitted and then forgot about. Digital skills training within the city should be provided to support people to get online, but also a support element for people to understand how smart technology can benefit deaf people, e.g. live transcribe apps, smart home apps and apps for deaf people specifically. Salford Council and Salford Health Authorities use different VRS applications. There should be a clear way to signpost services from Sign Live, Sign Video and other similar apps promoting the use of these and training so people can build their confidence in its use. Theme 7. Accessible housing. Salford Home Search can only be visited in person at Swinton Civic Centre. Deaf people cannot access an interpreter, lip speaker or other on arrival. There is no staff based at the Civic trained to deal with deaf and deafblind people. One deaf person has recently been waiting in excess of 9 months for an accessible appointment. A complaint was made to Salford City Council, but this was not replied to. Emails not responded to in a timely manner, and there is no generic email contact. As a result, there is no equitable way for deaf and deafblind people cannot do this currently accessibly, and is discriminatory under section 15, 19 and 149 of the Equality Act 2010. At a recent Greater Manchester Disabled People's Panel meeting, the chair of the Greater Manchester Housing Partnership was asked specifically about accessibility, and we've since, with the panel meeting via our connection with Salford Disability Forum, tried to engage with the chair of the Greater Manchester Housing Partnership. It was additionally CC'd to the lead member for housing, and to date no response has been received from either Greater Manchester Housing Partnership or Salford's lead member. Salix Homes has made some improvements after making representation. Out of all the housing providers operating in Salford, Salix is the only provider that deaf people can text, WhatsApp and contact via Sign Video, a sign video relay interpreter app. Other representations from us directly and also from other individuals spanning a great length of time in years, in excess of 20 years, has meant little or no change for residents. Pendleton Together, Derive, For Housing, Moscare St Vincent and more. Recently, the Greater Manchester Housing Partnership has been asked to improve or for a meeting to discuss these. Little has been done. Improvement is needed for these providers and organisational bodies to be accessible for deaf and deafblind people. Recommendations. Work with GM housing providers to establish a standard all partners should adopt to ensure deaf people can access providers accessibly, urging non-members to agree to this too. Salford Home Search to ensure they have a way to communicate with deaf people at point of contact, so not discriminating against people due to their communication needs. Greater Manchester Disabled People's Panel through Greater Manchester Coalition of Disabled People to help create some guidance and support us to work with Salford Place-Based Lead to help Salford and the wider Greater Manchester Housing Partnership to ensure they are accountable, possibly linking in with the Greater Manchester Combined Authority and the Places for Everywhere agenda. Theme 8. Adequate provision of personal assistance. Deaf people accessing services like the Salford Deaf Community Drop-In since 2022, we've had 52 deaf people access our service. For hearing people, it's included 27 council staff, 25 primary care healthcare staff, and over 15 secondary healthcare staff and 50 plus VCSE sector staff have approached us for help, information and support. This is just Salford. There has been people further afield. In total, over 12 months, there's been over 600 interactions with the drop-in service. This roughly equates to 1,456 hours, which would cost £43,680 worth of support. 864 hours is currently funded at a cost of £25,920. Funding is currently provided by Salford City Council via Salford CVS until April 2024. Recommendations. Look to ensure funding or provision is secured to support ongoing work, the creation of a D-Deaf partnership board and the Salford Deaf Community drop-in service continuing from May 2024. A holistic approach to recruit more language service professionals to DA languages and the Northern Care Alliance's in-house service. Also, to keep this on the agenda for the proposed Salford Council's Salford Interpreting and Translation Service, something that is currently not formally drafted or proposed. Work to promote the use of language and interpretation services. Encourage D-Deaf people to ensure when they don't understand or are asked to lip read when they cannot do so to stop appointments continuing. Have a reporting structure for this to record unmet need. Look at the recruitment and training of BSL interpreters. Currently there are 9 in Salford. Lip speakers, we have 1 in Salford, and deafblind manual interpreters, we have 1 in Salford. Ensure feedback from language service professionals is taken on board for future tender specifications, and ensure feedback is received by commissioners during current contracts to ensure optimum provision for D-Deaf people and staff using interpreting and translation services. Ensure council and health services have access to video relay interpreting from professionals' side and also for deaf people accessing council services, so there is an empowered independence. Work with funders and people bidding for funds to think about making projects and activities that D-Deaf people want are accessible at the first point of contact or have specific activities available. Theme 9. Inclusive Education and Training. Quote, no public deaf awareness, British Sign Language or lip reading courses in the city for nearly 14 years. It's been requested to Salford College to do this, but no movement has happened after 2 years. The Angel Centre in Salford ran an advert in early 2023 for a 10-week taster British Sign Language course. This was heavily oversubscribed, which shows the want for BSL training from all parts of the city. They plan a second and third course when funds permit. Langworthy Cornerstone Association, where Salford's D-Deaf community gathering is based, have arranged BSL training for all of their in-house staff, starting in September 2023. This is a credit to the association due to staff asking for this to ensure D-Deaf people are included in services offered by the association accessibly. It is also a future cost saving on booking interpreters too, a clear commitment to the D-Deaf community. Recommendations and actions. Ask the Equality Lead to encourage the Education and Skills members to encourage Salford City College and other training providers to ensure British Sign Language and also from 2025 a GCSE Sign Language and lip reading courses become available options in the city. The creation of the Salford Interpreter Network, Interpreter, Lip Speaker and Deafblind Network, and training including D-Deaf people that supports co-working and provides training opportunities for professionals and those in training to help them qualify and provide support training opportunities. Identify training for D-Deaf residents to learn to become BSL tutors, deaf awareness trainers, and also to create a deaf awareness curriculum for Salford approved by Salford's deaf people. Theme 10. Equal employment opportunities. No targeted recruitment or training or leadership to encourage employers to recruit deaf or disabled people is apparent. The needs, the skills and work services at Salford Council to think about this. Many, to our knowledge, deaf people have left the city to work outside of it, some travelling great distances when they could actually be working locally. Caring work opportunities are not generally accessible in Salford, and 2 deaf people work with a Greater Manchester-based agency but can be posted anywhere in the northwest. Access to work, backlogs and renewals and new applications, the payment of interpreters and language professionals, and the need to make this service fit for purpose is important. This makes employing new staff difficult, and also getting guarantees for interpreters and language professionals at interview stage to provide incredible amounts of stress and anxiety on deaf people. Mentions here should be made to the Eccles Job Centre's Disability Employment Advisor, who has spent many hours assisting deaf people in training, skills and courses to further improve their employability. This has been a complex task and has been positive for the DEA's work, but also the deaf client too in upskilling them. There's been a periodic check-ins with both us and them to discuss progress and also networking opportunities for employment. Recommended actions. Salford City Council to look at ways to improve job training opportunities, to look at recruitment of deaf people into suitable roles and be a role model for others to follow. To work within its Education and Skills Task Force to seek and share good practice examples for employing deaf and disabled people within the workforce. To make representation to Salford MPs to speak to relevant heads of the Department for Work and Pensions Access to Work scheme to find out what is being done to tackle the backlogs and continual issues. To work with disability employment advisors in all Salford job centres to identify employment opportunities, candidates, and work with trusted employers to consider opportunities. Theme 11. Independent advocacy and self-advocacy. In April 2020, through the Salford Clinical Commissioning Group, Manchester Deaf Centre set up a project that spanned 4 days a week over 2 years at a cost for £120,000. In May 2022, Salford deaf community has worked with over 40 deaf people to provide advice, information, guidance and advocacy support in a variety of situations, but significantly in representation to health services. There have been no Level 3 trained advocates working with deaf people. However, both the Deaf Centre and Deaf Community Services brought a wealth of professional experience working within the deaf community, from a child of deaf adults to qualified and experienced BSL interpreter of 23 years. This has led to a change in services for the community. In April 2023, Level 3 advocate training was offered by Salford CVS to us and Salford Disability Forum, but this hasn't been forthcoming. Other independent advocacy provided with the city is via Mind in Salford. However, self-referral in BSL is not an option, and this is important to ensure funded monies are also including monies for accessibility. Self-advocacy, individual and as a community. See also number 13 below. There's been a 2-year journey for our deaf people in Salford to share their lived experience and provide accurate guidance to channel this into the right public service mechanisms. In many deaf gatherings over the years, residents have complained about the lack of change and service improvement. Many complaints have been sent to the council, primary and secondary health services, and currently a process of making representation to the Parliamentary and Health Service Ombudsman has been initiated. During February 2023, funding was offered by Salford CVS to continue the drop-in services at Langworthy Cornerstone, and after a considerable amount of discussion, the link worker arranged for Salford CVS's grant manager to meet with deaf people to share their thoughts, concerns and feedback on previous findings provided by the now Salford ICP. This was a key moment for deaf people to speak directly with managers. They were and felt empowered and had the opportunity to speak with people who have the direct power to make a difference. There is a clear exhaustion when deaf people speak via engagement exercises. They largely never see results or their efforts to engage and receive feedback. In August 2023, Merseyside Society for Deaf People's Community Engagement Officer created a social media clip encouraging deaf people to not just nod and give their thumbs up during appointments they don't understand, but be assertive and say this is not an acceptable form of communication. The video highlighted a key theme that if you do it, it'll happen to others. So help yourself and help stop it happening to others. Theme 12, peer counselling. This is a major issue. Training is needed so that deaf people listen to their peers and can then ably offer appropriate responses. Quote, it's key that here people get training to counsel in a peer counselling scenario, but also get training to signpost people to other services, not just agree and then procrastinate. Theme 13, Salford Deaf Community Gathering. See also number 8, adequate provision of personal assistance. Whilst we look at other organisations, we should in fairness be inward looking to ensure that we can function. It's key to make sure that we also aim to ensure we as a group are working for deaf people who live and work in the city. For many years, the Deaf Community Gathering has existed to meet monthly, have engagement from the local authorities and small pots of money for room hire, the odd excursion and an annual meal. Since the pandemic, both Salford CCG and Salford Council have provided significant investment to us, allowing us to empower, support and reach people previously off the radar. We've been able to meet people's access needs and empower them to ensure their voice is heard, sometimes in a very assertive and unconventional way, another more positively with teamwork. Our constitutional aims, in summary, ask for us to work with other partners and stakeholders to plan, review and improve services and information for deaf people. We've identified key themes when people struggle to access services around them, mostly with the lack of English skills, the need to understand someone's need for BSL, and to write this in English form to help empower people onwards. Be digital support when people's access informal services online to help them fill out forms, to use video relay interpreting service, and we've helped many people make complaints to a variety of agencies, ensuring this is trauma informed and supporting people to not have to repeatedly relive experiences. With the community link worker, over the last 18 months, they've provided many opportunities to engage with deaf people, deaf people's organisations, services and the wider authorities, including the private sector, to encourage accessibility and to ensure deaf people have equity when accessing services. We have had the support from various individuals from Salford Integrated Care Partnership, Salford Council, Salford CVS, although not mentioned by name due to this being publicly available. Their help, advice, support has been invaluable in supporting the deaf community. A special mention should also be made to Manchester City Council sensory team, who have at times provided professional support and guidance, and even offered us training and mentoring support to the community liaison officer. The individual and the team manager are thanked here. We also thank Salford Disability Forum's board and its voluntary staff for allowing us to use their office in September 2022. This has provided a base to ensure many meetings and services that were previously trying to be conducted in home visits and coffee shops, when sometimes information transfer has been very difficult. Their accessible office space has been priceless. Quote, I wish to say this report is a tribute to and for the many deaf people and their families in Salford who have provided their time, their lived experience, and even been willing to go on camera with one common aim, that they and other deaf people don't suffer in the future. It's not been for financial gain, but selflessly in the hope that services improve. This report firmly lays a foundation for those organisations wishing to effect change to work with us to make services accessible for deaf people in the same way and at the same time as their hearing peers, and thus empowering deaf people to access services independently. This has come from Andy Higgins, the Community Liaison Officer. Recommendations. For the community service liaison worker to work towards level 3 or above in advocacy, and also have a greater knowledge of trauma-informed practices. To make representation to Salford MPs and to speak to relevant heads of DWP's Access to Work scheme to find out what is being done to tackle backlogs and continual issues. To write to the Parliamentary and Health Service Ombudsman and to the Care Quality Commission with the current list of complaints outstanding, and to provide the context asking for them to conduct an investigation. To create a formal, supported mentoring programme like the one provided from Manchester, or it could be from Salford Sensory Team. We should seek training opportunities for the leaders and the committee and future leaders to develop their skills to ensure the group's survival into the future. We should further develop links with our trusted individuals, partners and others to further support deaf people to be empowered and to strive for the equality and equity in the city. Further promote our group, deaf people across the city, and for people who live, work and access services to contribute their voices in how they want services to be run, and also encourage people to participate. We should follow the Merseyside Society for Deaf People post of August 2023 to encourage deaf people to stop appointments when they don't understand straight away, and to not after the fact ask for support, or to just nod or thumbs up when they're not clear on something. This is to empower deaf people on their rights. We should further develop lasting relationships and legacies that deaf people will find useful now and in the future, whilst also holding those accountable, responsible for failure and discrimination. In conclusion, this report is as it stated at the beginning, to provide an overview of deaf people's accessibility in Salford in 2023. The document is to promote debate, engagement in a trauma-informed way, and to ensure services are compliant with the Acts of Parliament, guidance and strategies that have been provided to us. This is a starting point to develop further, and this report is not exhaustive of all the issues. Quote, deaf people who live and work in Salford should be able to access all services in the same way as their hearing peers, at the same time, and have the ability to do so independently according to UK legislation and the United Nations Convention on the Rights of Persons with Disabilities. In summary, some key recommendations. Ensure health and council services set up and deliver approved by Salford's D-Deaf community deaf awareness. Ensuring services are accessible to D-Deaf people measured by its results, and actually making the community responsible for their own destiny. Establish a Salford D-Deaf Partnership Board with a truly representative voice for the D-Deaf community of Salford to feed into all aspects of public life in Salford, using trauma-informed practices. There is adequate funding should be used to make sure a variety of D-Deaf people are remunerated fairly for their time. And representation should also include professionals and grassroots members of the community. It is vital to include younger deaf people too. For key commissioners, stakeholders and decision makers who have a can-do attitude and to engage with Salford's D-Deaf community to ensure your services and technology is fit for purpose and accessible. Seek to establish a network of professionals, including D-Deaf people, working with D-Deaf people in Salford, with the above to ensure there is a legacy and that there is a D-Deaf-led approach to services. A holistic, accessible directory of Salford D-Deaf services from statutory authority to the VCSE sector. Quote, many of us rely on lip reading and facial expressions, so face masks rob us of valuable information when we communicate. I recently conducted an experiment and counted the number of times in one day I had to prompt individuals to take down their mask so I could understand them. 6 was the answer. This equates to over 2,000 times per year, which is a sobering statistic and also hard work. That's from Jamie Miller, a senior physiotherapist in NHW Hospital. Another quote, I've campaigned for over 30 years for things to be more accessible, and they're not. I'll be dead before they are. From Christine, who is a Salford resident aged 66. There then follows a glossary of terms, references and contact information. You can contact Salford Deaf Community Gathering via the Salford Disability Forum office, based at Langworthy Cornerstones, 451 Liverpool Street, Salford, M6 5QQ. You can contact them by voice, SMS, WhatsApp and WhatsApp video on 07799118968. You can email salforddef with 2 D's in the middle, salforddef@gmail.com. On social media, using Facebook, Twitter and Instagram, our handle is @salforddef. Thank you.